Good morning. My name is Mitzi. I'm the Director of Cardiovascular Services and Intensive Care. Are any of you sick of the pandemic? I am. Are you tired of hearing the words COVID, coronavirus? I know I am. How many of you have sat and watched the news and you started counting in your head how many times the newscasters say COVID or coronavirus? I know I have. And I know my staff have. They're tired. First of all, I want to thank the community for those that have been following the guidelines and trying to help prevent the spread of the virus. And I especially want to thank the staff for all their hard work. I can't even say it. They're fabulous, okay? Sorry. The staff they absolutely love what they do. They're here because that's their passion. And you can equate it to the military. The military who go out on the battlefield and they're willing to put their lives at risk for you. That's what the frontline staff are doing today. They're putting their lives at risk for those people to take care of the people with the COVID virus. And they're putting their lives at risk because they just rush in. It doesn't matter. They put on their PPE, they rush in and they take care of the patient. It could be somebody that's being violent, swinging, kicking, spitting at people. It could be somebody that's bleeding profusely and there's just blood everywhere. Or it could be one of those COVID patients. However, this is not without a cost. As with the military, we've all heard of how the military have PTSD. So does the frontline staff. Although theirs are a little bit different. Staff are dealing with patients. They're dealing with families. They're dealing with these patients and families yelling at them, screaming at them. Visiting hours are decreased right now to help prevent the spread. So they're calling in. They're calling, repeatedly calling. And when they answer the phone, they get nothing but screamed at because they can't come in and visit their patient or their family member. They could be screaming at them because we didn't answer a call light fast enough. We didn't get their food to them fast enough. Or some of them just don't want to cooperate with what the medical care wants to do and they leave. It's frustrating, and it's very frustrating for the staff to see how they're getting disrespected by some of the community members. But it's also frustrating when I see the community disrespecting our businesses. I have a sign here. We see this sign on almost every business, especially the Circle K's and the convenience stores. We don't think anything about it. How many times have you seen the dude walking in his board shorts and he's real quick putting on a t-shirt as he walks through the door? Nobody thinks anything about this sign, right? The next one, but now we see these signs. Some of them are red. Some of them are just very plain. And we hear people yelling, I'm not going to wear a mask. I watch people walk in and out. I'm not going to wear a mask. It's my right. Well, unfortunately, it's not a right. Because going into that business is not a right. That business can tell you you don't have to come in. It's a privilege to participate and to go in and buy things or do whatever you want to do in that particular business. I personally was in another city a couple of months ago during the heat of the COVID round 1. And it had this same sign. Actually, it was a no mask, no service sign. And I had my mask on. I walked up to the door as another gentleman was walking in without a mask. And the staff stopped him, pointed at him, and said, you cannot come in here without a mask. And he turned around, went and got a mask, and came back. So it can be done. If we want to get back to any kind of pre-COVID normal, then all of us have to participate in the solution. We can't leave it up to the medical community to fix us. As much as we want to celebrate with our families, we have to limit that also. Have any of you read on the internet about a wedding reception on the East Coast? I don't know how many people, but there was definitely more than the recommended amount of people went to this particular wedding reception. Most chose not to wear a mask. Many became symptomatic and went to work, thus spreading the COVID infection. 7 people ultimately died from this super spreader event just because people wanted to do what they wanted to do. A nurse came up from the valley, from Phoenix recently, to be, I think she was a travel nurse, came into our facility and was absolutely appalled at our community and the lack of use of PPE, masks, the guidelines, and just the overall complacency that's here on the mountain. But how does all of this affect our staff in our hospital? Well, it increases the spread of the virus. Our ER volumes go up. Our inpatient units are virtually full. We've spread to my ICU, has spread to other departments because I have too many ICU patients to fit within the confines of my normal ICU unit. It increases the risk of the staff to get sick. Staff do their best to not get sick, but they need their help. How else has it happened or impacted the staff? Staff have gotten COVID. One couldn't even attend the birth of his own child. Several others have had health issues that have ruined their careers and their livelihood because they can no longer practice as a nurse. Staff feel like it's Groundhog Day. It's the same thing over and over and over again. They're exhausted. You can see it in their face. You can see it in their eyes. Some have become virtually catatonic at times. They don't even know how to function at times. They're emotionally bankrupt. The effects of the virus affects them physically and emotionally. The stress has caused nurses and other staff to quit. I lost a nurse. She gave up her nursing license. She couldn't take it any longer. They have red eyes, sore noses from the masks, chapped lips, dry hands from all the hand washing, the hand sanitizer. I can't show you my staff today, but and I know you've watched the news, and you've seen pictures of staff in New York and California, etc. Put that here in Show Low. It's the same thing. What have staff done to help prevent the spread? I've had staff members living in campers in their backyard because they come home from work and they're afraid to potentially have brought the virus home to their family. One of my nurses tells me that she would walk in her back door, totally strip down, throw her clothes in the wash right away, go take a shower before she even greets her family after a long day work. Some of them shower before they leave the hospital. They're angry. They're angry at each other. They're angry at community. They're starting to lash out at each other. This all gets back to that PTSD that we saw with the military. There's fear of being exposed. They're not afraid of getting the virus themselves. They're afraid of spreading it to their own patients. Staff wear masks for 12 hours a day. All we ask is the community to wear something as simple as this, a cloth mask, or the surgical mask. People say, oh, it fogs up my glasses. Well, that's great. You put it on, pinch it around your nose. If it fogs up, you know you don't have a good seal. Okay? This is what the staff are wearing. They're wearing these masks, or they're wearing the duckbill mask. These are considered respirators. They're very difficult to breathe through. Some people cannot even be fitted to wear these. You have to go and be specially fitted for these particular masks. It's the only thing that will protect them from the virus. They also wear face shields. They wear eye protection. All of this to help take care of the patients in the department and the people of our community. So what are we trying to avoid? This is what we're trying to avoid. Closer. I got a newsletter the other day. I just want to paraphrase in closing. This is a letter it was jointly written by the American Hospital Association, the American Medical Association, and the American Nurses Association. It's an open letter on COVID-19 holiday gatherings, specifically to the American public. It says, I'm going to get emotional. We strongly urge that everyone throughout the country celebrate responsibly in a scaled-back fashion to limit the virus spread, reduce the risk of infecting family, friends, and others that you love. Throughout the pandemic, the spread has followed a similar pattern around holidays and mass gatherings. We saw positive cases spike after Memorial Day, after 4th of July, after Labor Day, and after Halloween. Record-shattering surge is underway, resulting in uncontrolled community spread and infection that's already overburdened the healthcare system. Some areas will ultimately consume the capacity of our healthcare system and will reduce the availability of care in many places in our country. That includes here in Show Low. In the very strongest terms possible, we urge you to celebrate responsibly. We are all weary and emphasize with the desire to celebrate the holidays with family and friends. But given the serious risks, we underscore how important it is to wear masks, maintain physical distancing, and wash your hands. Following these science-based, common sense measures, it's the best way to prevent our healthcare systems and dedicated healthcare professionals from being overwhelmed by critically ill patients. We absolutely must protect the doctors, nurses, and other caregivers who have tirelessly battled this virus for months. You can do your part to ensure they can continue to care for you and your loved ones. We will get through the pandemic, but the only way out is to follow the science and adhere to the public health steps we know that work. Thank you.